Hi there folks, this is Dr. Burke Mays with Pathways Integrative Health Center. This is our video, Neurometabolic Solutions. Neurometabolic. Hi folks, this is Dr. Burke Mays with Pathways Integrative Health Center. This is our video on neurometabolic solutions for fibromyalgia and chronic pain. Now, if you're watching this, either you or somebody that you know about is dealing with the chronic long-term effects of fibromyalgia and chronic pain. And I want to let you know as you listen to this, first off with fibromyalgia, there is no definitive diagnosis. You know, the American College of Rheumatology says that if you have out of 18 points in your body, if they put pressure on 11 of them and you have pain discomfort, that qualifies as a diagnosis of fibromyalgia. And you combine that with all the common things that go with it, the fatigue, the brain fog, the sensitive lights being sensitive to the eyes, the digestive issues, the sleeping issues, a whole spectrum of things that travel along with that, that comes together into the diagnosis of fibromyalgia syndrome. More importantly, what we look at in our office is what are the underlying causes? What is happening? Why is your body reacting like this? And then, equally important, what can be done about it? Over the course of the next 45 or 50 minutes, we're going to talk a lot about that. And at the end, I'm going to give you the exact next step that you can take to get yourself back on your road to health and wellness. So a little bit about me. My name is Dr. Burke Mays. I'm a chiropractor here in Minnesota. I've been practicing for almost 20 years. And I'm also a member of the International Association of Functional Neurology and Rehab. And over my 20 years in practice, I've taken hundreds of hours of functional neurology, functional medicine, blood chemistry, nutrition classes, all help me focus on what I'm specializing in my office, which is dealing with the chronic long-term patient. We still see our typical traditional chiropractic patients, the back pain, the neck pain, the headaches, the sciatica, but even still with them, this model still does apply with them. But really where my interest is helping people dealing with chronic conditions. And one thing to kind of start out with and look at, just kind of set the background, as we take a look at our healthcare system. Our healthcare system is really, really good at the acute conditions, the fractures, the traumas, the heart attacks. This is the best place to be in the world for that. But as many of you might already know, one of the shortcomings is dealing with chronic conditions. Or we're going to learn more here today about dealing with neurometabolic conditions. And one of the reasons for that is our healthcare system is a very pharmaceutical-driven system. Every solution involves a medication. Unless it gets really bad, then it's a surgery. And one thing to really understand is with chronic conditions, the only way to deal with them is you got to find the underlying cause, what's happening. And with fibromyalgia and chronic pain, I'm going over some of those underlying causes. And then most importantly, what can be done about them. If you're watching this, obviously as I've already touched on, if you have fibromyalgia or chronic pain, there are many underlying causes to it. It can be poor gut function, poor brain function, it can be hormones, it can be blood sugar, it can be allergies, it can be chronic infections, it can be a lot of different things. And to address those, you really have to get outside of that pharmaceutical-driven model. It's kind of, if you look, it's kind of insane in our country. Our country represents 3% of the world's population, and we take about 50% of the world's drugs. To me, that's a bit of a problem. Where we have a model where the solution lies in a pill, and that's the only solution. You cannot medicate yourself back to good health. You just can't. In fact, I just invite you to do this for yourself. When I'm doing workshops and larger lectures, I ask this question. What are 2 things you can do to be healthier? People might say, I can exercise more, eat better, sleep better, stress reduction, quit drinking, quit smoking. I've never heard anybody say, well, one thing I can do to get healthier is take more drugs. It's not the way it works. So chronic conditions and chronic health issues can only be addressed by getting into the underlying causes. And some of these underlying causes, I got ahead of myself here. When we look at almost everything that comes into our office, all chronic health conditions have some common threads. So if you come in and you have fibromyalgia, there's almost always digestive issues, there's almost always blood sugar issues, there's food sensitivities, and want to be really distinct, not food sensitivities, but food not food allergies, but food sensitivities. I'll talk more about that later. Blood sugar issues, there's vertigo, there's chronic fatigue, there's peripheral neuropathies, there's, there's a whole host of things. And all of those have some common underlying metabolic issues. There can be anemias, there can be thyroid dysfunction. Almost every fibromyalgia patient I've worked with has some underlying poor thyroid function. Not just a high TSH indicating their thyroid's not working effectively, but really when you look at thyroids, there's between 6 to 21 different patterns where thyroids can go off, not function normally, shows up in poor health that just aren't addressed by our standard model. There can be effects of chronic stress, hormone imbalances dealing with progesterone, estrogen, testosterone, insulin, all the different hormones we have. There can be autoimmunity, hidden infections in the gut or chronic viral infections, food sensitivities, low oxygen, chronic inflammation, and at the heart of all of it, a poorly functioning, poorly balanced brain and nervous system. So at a really, really basic level in our body, all the food we take in, we convert into either sugar or short-chain fatty acids. We eat food, and inside of our cells, there's little things called mitochondria, and they're the big powerhouses that they take our food and turn it into energy. That's our metabolism, food to energy. Very complex biochemical process, really critical to our life. But at the basic level, we take food, make energy, and people with chronic conditions don't do that efficiently. So just a question. 30% of the energy that you make goes to what system? Is your endocrine system, digestive system, nervous system, immune system, cardiovascular system? The answer actually is your nervous system. Your nervous system makes up about 2% of your body weight, and it consumes 30% of the energy that you make. So if you have an underlying metabolic issue where you're not making energy efficiently, it's going to affect the nervous system first. Show up, and your brain's always going to be affected first. With poor fuel, you get poor nervous system function. It shows up in a lot of different symptoms we're going to talk about in a few minutes. So it's important. Fibromyalgia and chronic pain is a neurological problem due to an underlying metabolic challenge. A little bit about your nervous system. It's going to be really basic, but your nervous system has some major parts. Your brain, your spinal cord, your nerves. Your brain is a central processor. Takes information in, processes it, sends information out, tells your body what to do. Your nerves are the communication cables. They carry the information back and forth. Then out in your body are cells called receptors, and they send information into your brain by way of your nerves. And your brain, in a sense, it's a big sensory organ. Everything that goes on is perceived by your brain. It's one big receptor organ, and it relies on input from lots of different places. For your muscles to tell you about gravity, your joints for position, skin about touch, ears tell you about sound, eyes, sight, nose, smell, mouth is taste. That's all input into your brain that lights your brain up and makes it work. Your brain needs input to function. One thing we would take people and put them in a sensory deprivation chamber. They sit there, they float in salt water, perfect body temperature, no sound, no light, no contact, and let a person sit there for a while. They literally start to have significant brain and nervous system issues within literally under an hour because it needs input to work. So what gives you the most input to your brain? What lights your brain up the most? Movement and gravity. I didn't touch there because it's kind of part of movement. But movement and gravity lights your brain up the most. And if your brain is fatigued, it's going to get worn out by those things. So you might be that person who wake up in the morning and you feel good. But as the day goes on, you fatigue rapidly, and your brain doesn't work. You get brain fog, you get photosensitivity. That's that brain wearing down because it can't handle the information. So basic parts of your brain. Back here, the base of your skull back here is a part of your brain called the cerebellum. That is where all the movement information in your brain, almost all of it passes through there. It gets processed. The cerebellum is responsible for your balance, for your coordination, your awareness in space, and then it carries information over to other parts of your brain. It travels over to the opposite side of your brain, to your different lobes of your brain. We don't go into those in detail, but there's the other half of your brain where everything is processed. Then information travels out from the other side of the brain, out to your body, and some goes into an area of your brain called your midbrain. Midbrain is that's all where your housekeeping takes place. Your respiration, your breathing, your digestion, your coordination of survival function in your body. So how it works is sensory information out here goes through your cerebellum on one side, gets sent over to the other side of the brain, organized, processed, things happen, information goes out, tells your body what to do, and then part of it goes into that midbrain and controls it and puts the brakes on it. And more about that in a second, but it's a really important point. And by the way, without that braking effect, like putting the brakes on something, this is where a lot of our problems come from. So we have 5 categories of neurological problems in patients. One is abnormal sensation. That's your brain is always inhibiting something. Like your brain is always turning things down. Like when you get up in the morning and you put your clothes on, the first thing you notice is you got your pants on, you got your shirt on, you got your shoes on. But within a few moments, you don't notice that anymore because your brain has turned that down because you don't need to have your attention on that. And part of what happens in people dealing with fibromyalgia and chronic pain is pain signals don't get dampened. They don't get turned down, so then you're constantly being aware of them. Also things like cold hands, cold feet, tingly extremities. Movement. Whoops, I got ahead of myself. Again. Whoop. So movement, that's a tremor, or when you turn your head, your eyes have to move in a certain way. Or you have balance issues, or motion sickness, or poor coordination. You get spasms and twitchies. Or movement is your gut. Your gut doesn't move enough, or it moves too much. So maybe your slow digestion, where food stays in you for a long time, or it passes through you too fast. That's also abnormal movement. Abnormal cognition, that's thinking. How is our higher mental processes? That shows up with things like depression, anxiety, poor focus, ADD, attention span, brain fog. Those are all things of poor cognition. Posture. It takes a lot of energy to stay upright in gravity. And if your brain is tired, your brain is fatiguing easily, you start, what goes first are your extensor muscles, the ones that hold you up. And you start to see this posture like this as gravity starts to pull you down. Abnormal autonomics. So autonomics is the part of your nervous system that controls all those things unconsciously, like your digestion, your breathing, your hormone activity, how you heal, how you digest something, how your liver works. All those things are being controlled by your sympathetic nervous system. your autonomic nervous system. And it has 2 divisions, your sympathetics and your parasympathetics. And an example of that is parasympathetics, that's your fight or flight. So think of what your body is doing when you're scared of something. Like you're walking down the street and you see the big animal chasing you, think of what your body does. Heart rate goes up, blood pressure goes up, digestion shuts down, brain's not paying attention to things, you don't see things the same way. So sympathetics is that whole fight or flight response. Now there's an appropriate time for it. But imagine you're spending your whole life operating like that. That's a problem. Parasympathetics is the opposite. That's the calming. So part of what the brain does is when it's working normally, it's putting the brakes on the sympathetics and it's letting the parasympathetics do their work. So that's that. Just think of what you're doing. You're laying around relaxing. You digest your lunch. You can sleep. You can pay attention. You can focus. You can read a book. You can think. You have memory. All of those are related to the autonomics. So about 70% of the brain is the brake pedal, putting the brakes on the sympathetics. And now if you get a weakness in one area, you get increased firing in another area of the brain. So when your brain fatigues, you lose the brakes and you start to develop issues. So 2 areas need to be inhibited the most. One is your sympathetics, and the other is your limbic centers. So sympathetics, over-firing sympathetic nervous system can cause things like chronic pain, chronic fatigue, irritable bowel, poor digestion, sensitivity to light and sound, urinary tract infections, fibromyalgia, muscle tension headaches, poor posture, overworked adrenal glands, those are the glands on top of your kidneys to help you create the hormones to respond to stress. But if you're constantly firing, those parts of your body wear down. Now you start to have a worn out response system, which causes other issues. Examples when the limbic system isn't being inhibited: irritability, cranky, you can't focus. Anxiety, OCD, depression, mood swings, all those things that involve some of our higher functions. Some other examples: when the mesencephalon is a part of the brainstem. So when the brainstem starts to fire too much, when the upper brain's not turning it down, the adrenal medulla starts to fire too much, release all your stress hormones in your nervous system. Well, not all, but you release them all the time. And then you start to oversensitize what we call type C nociceptive fibers. Those are the fibers in your nervous system that tell you about pain. So if those fibers are overactive, you're going to feel the sensation of pain more frequently and more often. And when you're under pain, you don't sleep well, so you get fatigued. And on the concept of fatigue, when the mesencephalon's firing too much, it's going to upset the parts of the brain that regulate sleep. So you either can have issues where you're tired during the daytime when you shouldn't be because it's, that system's shut down, or it's too active and at night you have insomnia. So oddly enough, dealing with insomnia often deals with healing and supporting the brain, given the environment that it needs. Emotional stress. When you're under stress and you release those stress hormones, they affect a part of your brain called the hippocampus. The hippocampus is a part of your brain related to memory, and your brain's very sensitive to cortisol. In particular, the hippocampus is very sensitive to elevated cortisol, those stress hormones. When that happens, you get those problems focusing, those problems with short-term memory we call fibrofog or brain fog. That's all the elevated cortisol due to chronic stress. When that midbrain fires too much, you develop the blood vessels around your brain dilate. Increased blood flow creates irritation, like those migraine headaches and chronic headaches people experience. When your cerebellum gets tired, remember that major processing station back here. Now you get those things of balance issues, you get vertigo, you get clumsiness, headaches. The cerebellum has a lot to do with controlling the muscles in the back, so often you'll see back pain, neck pain is often related to fatigue and poor function of the cerebellum. And a real simple test, you can do this right now. If you want to do this, stand up from your chair, just put your feet together so that both feet are touching, look straight ahead, hands by the side, and close your eyes. You should be able to stay pretty steady for about 10 seconds. If you find yourself starting to sway more to one side, or you just can't hold it and you fall over, that is a weak and fatigued cerebellum. Or you might start out good, and you can hold it for a little bit, but then you start to get that sway and that wobble to one side. That's where you had a decent firing cerebellum, but it's not real healthy and it fatigues rapidly. Or you can do something also, you stand there, you put your hands out in front of yourself, close your eyes, touch the tip of the pinky to the tip of your nose. Tip of pinky, tip of nose. You should be able to find that with your eyes closed. If you miss, you put your fingers in your eye, or you hit your mouth with it, or you hit the upper part of your nose, you just miss that tip of the nose, that's a fatigued, poor functioning cerebellum. Or if you start out good, but then you start to miss, that's where that cerebellum is fatiguing. And you'll see that once again with the people where they might feel good in the morning, but as they're up and moving around, their brain fatigues, they start to feel worse, their back hurts more, the neck hurts more, because they're losing that good control of their back muscles. And by the way, if we're not getting good information happening here in the cerebellum, it's going to affect the opposite side of the brain. So when we see that, now we get, now we're getting that good, we're not getting that normal inhibition of the sympathetic systems, and the sympathetics get away from us. Overfire a sympathetic nervous system, that's things like blurry vision, increased sweating, difficulty falling asleep or waking up at night where you get to sleep because you're exhausted, but then you wake up at 3 o'clock in the morning and you're still awake. Dizziness, vertigo, heart palpitations, high blood pressure, cold hands and feet, sensitivity to sound. Another thing we see with long-term stress is elevated cholesterol. In our physiology, when our body is under stress, it's expecting damage. So it releases cholesterol because cholesterol is very important for anti-inflammatory activity. It's also important for wound healing. So if your body is thinking it's under a danger, it starts to release cholesterol in advance to help get ready for healing. Upper brain fatigue can cause things like depression, anxiety, difficulty reading where you can't track across pages well, or you can't say what you want to say real clearly. You can't express yourself, or you don't maybe comprehend language real well, or maybe numbers don't make sense, or you just have to, like those moments you have to stop and think of something that should be so automatic, like 2 and 2 is, you got to stop and think for a moment instead of 4 coming out easily. It can affect learning. Learning also can affect focus. And also we get into things like altered sensations, numbness, tingling, phantom sensations, changes in handwriting. If you look at your handwriting from 10 years ago to how it is now, if it's changing, that's changes in the brain. Impulsivity, anger, irritability, cranky, weakness all over, kind of apathy, dyslexia, ADD are all signs of that upper brain fatigue and lack of coordination. So how does this happen? What happens where we're working good and then we stop working good? And the big thing is, it's the effects of stress. Chemical stresses, physical stresses, emotional stresses, all cause the brain to fatigue and the body to fatigue, resulting in less nervous system activity. So now, some common chemical and physical stresses of the brain. We look around our world. We live in a very stressful environment. And stress isn't necessarily good or bad. Where the problem is when it's constant or perceived to be constant. For instance, what might be stressful to you might not be stressful to me, and vice versa. Or just the stress is in front of us all the time. That breaks us down because we don't get that time to rest and recover. So sometimes it's the perception of stress, and then the reality of stress, it's always there. So chemical and physical stresses to the brain, things like anemias. Your brain needs oxygen to work. So if you can't effectively deliver oxygen to your brain tissue, your brain doesn't have the fuel it needs to work. Or poor blood sugar balance. If you swing up and down, you get the hangries. Or you can't skip a meal without feeling angry, upset, and cranky. Or you have high blood sugar. It swings all over the place. That's a brain stress. Sensitivities. I want to keep sensitivities and allergies as a distinct thing. An allergy is like a peanut allergy, or the most common is like a peanut allergy, where you get exposed to the food and there's really a life-threatening reaction. I like to keep that separate from a sensitivity. While it's life-affecting, it's not critical, but it's affecting the nervous system, it's affecting the hormone system, it's affecting the immune system, and that can be to a lot of different things. And personally, I think a lot of the food sensitivities are acquired. The gluten sensitivities, the corn sensitivities, the dairy sensitivities, they're acquired sensitivities due to a breakdown in gut function. And what we also often see is just what we see in literature is that the nature of the restrictive diet that a person goes onto because of a food sensitivity creates more food sensitivities. So really, once again, even with sensitivity, you have to go back to the underlying cause. What's stressing the immune system? What needs to be done with it? The other way the immune system goes, not only with sensitivities, but autoimmunity, where your system gets confused and starts to attack your own tissues. A good example of that is Lyme's disease. Lyme's is really, really tricky because some of the bacteria of Lyme's has no proteins on the cell wall. And our immune system sees proteins as being foreign invaders and attacks them. So if there's no proteins on the cell membrane of the bacteria, your immune system doesn't see it, but it's still there reacting to you and doing things. It's putting a stress on your body. And then what happens is sometimes when you see it, it will identify as being like your own body and start to attack the Lyme's disease as well as your own tissues. And that's sometimes what its underlying causes to autoimmunity. Poor diet. We have the standard American diet is abbreviated SAD, S-A-D. We have issues with our food supply isn't as good as it used to be. We have chemicals in our food. We have genetically modified foods. We have lots of things where our food is different than it was 100 years ago, and we're not getting enough of the good things. And also, too, even our good things doesn't have the nutrient content in it that did in the past, just due to soil depletion. Poor thyroid function. I very often see with chronic pain and also with fibromyalgia is the thyroid's not working right. Now that can show up in a lot of different ways, not just the classical medical version of hypothyroid. The thyroid can break down in between 6 to up to 21 different subcategories of poor thyroid function that all have different therapeutic approaches that all are going to have an effect on health. Different medications and drugs, gabapentin and Lyrica are common medications given for fibromyalgia, and they are brutal on the neurotransmitters. The neurotransmitters are the chemicals that run our brain. Chronic inflammation can be to lots of different things. It can be to foods, food allergies, food sensitivities, poor diet, chronic infections, but elevated inflammation is going to cause stress to our brain. Hidden infections can be in the gut or other places. It can be Lyme's, it can be different viruses. Those all can cause stress. Mitochondrial dysfunction, I touched on briefly before. The mitochondria are the powerhouses of our metabolism that convert our food into energy. And they're very, very sensitive to chemicals, they're very sensitive to heavy metals, they're very sensitive to nutrient insufficiencies. A big one is with statin drugs. With cholesterol, people often take statins, and one of the side effects of statins is they interfere with the uptake and the utilization of a nutrient called coenzyme CoQ10, which is critical to those energy formation pathways. So in a sense, statin drugs poison your ability to make energy. MTHFR genetic defects. These are defects in methylation. It affects about 60% of the population, where you have a genetic predisposition where you don't utilize folic acid properly. Folic acid is really important for nervous system function, energy production, lots of different things. And just a little bit on genetics. Just because you have a gene for something doesn't mean you're predestined for something. Genes often just give you a higher degree of responsibility to take care of something. Like if you come in, you have the methylation defect, we're going to make sure you get the right forms of folic acid so you can bypass that defect. Hidden infections, chronic inflammation, we touched on those. But these are metabolic problems that create nervous system imbalance in your brain and in your whole body. Emotional stresses to the brain, adrenal gland disorders, cortisol imbalance. When you get too much cortisol pumping through your system from either too much stress or too much perceived stress, it's going to affect blood sugar, because it's going to block the effect of insulin in tissues. It raises blood sugar, elevates cholesterol. What most people don't understand is elevated cholesterol is often due to how physiology works, that one of the early steps towards moving towards diabetes. It's a sign of poor blood sugar control. So if you have high cholesterol, you're taking the statin drugs, which are poisoning your mitochondria, and you're not dealing with the blood sugar issues, which are upsetting everything else in your body. High insulin, high glucose levels cause breakdown of your brain and your nerves. And then you throw in the medications on top of it, really creates a pretty jumbled puzzle to work with. Now here's an important thing, as I touched on before. These conditions don't get better by themselves, and they can't be medicated out of. You have to go in and find the underlying cause and address that. And a really important thing, the longer a person has chronic pain, fibromyalgia, or even just chronic back pain, the longer they have it, with each year of chronic pain, it's equivalent to basically 10 years of brain aging. So chronic pain ages your brain prematurely. It actually causes a loss in brain tissue, a shrinkage of brain tissue. Now, patients in my office, I look at them both neurologically and metabolically. What does that mean? What does that look like? Well, part of what we do is brain-based therapies. Obviously, as a chiropractor, part of what I do is I take care of the spine and nervous system. And at a really basic level, your brain needs two things to work. It needs fuel in the form of oxygen and glucose, and it needs proper stimulation, proper activation, brain exercises and activation. It also needs things like, we say, no inflammation. That's not a reality. Actually, some inflammation is necessary, but with a very small amount. You need to have proper mitochondrial function. You have to have proper neurotransmitters. Those are the chemicals that make your brain work, the serotonins, the acetylcholines, the dopamines, and the things like that. By the way, just one thing to keep in mind, I might have touched on this earlier, but our gut, we make 60% of our serotonin in our body in our gut. So if you have poor gut function and poor digestion, you're affecting brain chemistry because you're not making your serotonin. You need proper hormones. You need proper activation through what we call neuroplasticity. So we used to think that the brain, once it got to a certain age, stopped changing, stopped developing. We've actually found out that that's actually the farthest thing from the truth, because your brain is constantly adaptable. It's plastic. It can respond to specific exercises in specific areas, can affect specific areas of the brain. Just for example, if you're sitting there and something goes by you in front of you and your eyes follow it, your one parietal lobe follows it, pursues it, your frontal lobe brings it back to the center, and then your opposite cerebellum keeps your eyes from going the opposite direction. So let's say you're somebody where you don't like busy environments. Driving in traffic is hard for you. Reading a book is hard for you. Being around lots of moving people are hard for you. Your eyes aren't tracking things well. So an exercise we might give you is simply following something. Following something that's going to activate your parietal lobe, your frontal lobe, and your cerebellum. So key points on neuroplasticity. Your brain changes when it's stimulated. They can be stimulated from many different sources. It can be smell, it can be sound, it can be exercise, it can be lots of different things. And different types of stimulation affect different areas of your brain. Now here's a really important part. You might have seen this, you might have seen a chiropractor in the past and he saw you and you got worse. And that's a really important thing to notice, is that what that tells me is that your system, your whole system, was not ready to receive that input, because a chiropractic adjustment is very, very powerful. If your nervous system is fatiguing easily, your brain fatigues easily, you'll get kind of a not pleasant result. Whatever it might be, more soreness, whatever the change might be. So I always look at that when somebody says, I saw a chiropractor and I got worse afterwards, tells me a lot about the state of their physiology. So things we use for brain activation. We can use an upper body ergometer. That's kind of a hand bicycle, but we'll do it on one side. One side is going to activate one side of the cerebellum. We'll do things like, I talked briefly about the eye exercise, we'll do things like vibration therapy. Vibration, you think about this, if you're in pain, to make it more simple, if you smack your finger, one of the first things we do is we do this, because movement information travels in the spinal cord and that helps dampen those pain signals. So vibration can be a really powerful way to stimulate that part of your nervous system to turn down the pain signals. Gentle neurologic adjustments. I want to emphasize gentle, as I touched on a moment ago. There's some people, if they had a poor reaction to chiropractic adjustment in the past, it was because their nervous system wasn't ready to deal with it. The closer we get to the spine, the more powerful the adjustment, the more powerful the neurologic effect of the adjustment is. Warm water calorics, warm water in one ear, is a very deep stimulation of certain parts of your brain. Balance therapies, balancing on one foot, balancing and doing certain things, all going to fire different areas of the brain. Stress exercises, stretching, auriculotherapy, smell can be very important. Visual auditory exercises, you might wear colored lenses and colored glasses. Those are going to change the activity in the brain. Looking at pictures of faces, faces that you know fires one area of your brain, faces that you don't know fires other areas. Mazes, word searches, puzzles, sounds. Nature sounds stimulate one area, a rhythmic metronome stimulates another area, so we can use those kind of things once we find the areas of weakness, identify the proper exercises for that. Often they'll do that in combination with oxygen. Brain needs three things to work: glucose, oxygen, and stimulation. So if we really want to fire a part of the brain, we give them the proper exercises with the presence of concentrated oxygen can really increase the activity and the results. So kind of once again, underlying metabolic changes affect brain imbalances. We deal with people both neurologically and metabolically. We talked briefly about the neurologic side. Now we look at the metabolic side. Issues like anemias, blood sugar imbalances, food sensitivities, immune system imbalances, adrenal gland disorders, thyroid issues, inflammation, and hidden infections, all can affect metabolism, affect energy production. How do we know if you have these? we need to have the slide change. There we go. We need to do the proper testing. And what does the proper testing look like? Well, sometimes it's doing the standard tests that you've done, but doing appropriate full panels of them and also looking at them differently. So many of you have already been tested, but you continue to suffer. You've been told, we ran a complete panel on you and everything's fine, everything's normal. So two things on that. One, a lot of the time I find a complete panel really isn't that complete. Often when you start looking at the relationship of things, you start to see holes. Thyroid's a great example. As I said before, thyroid breaks down between 6 major categories to up to 21 different subcategories, and all have different things you do to get a person better. And to get that, you need to actually run about 6 or 7 different thyroid panel tests in combination with other standard testing to really see what's happening so you can guide your therapy appropriately. But at the beginning, though, you got to remember with quality health care, the basic philosophy of our healthcare system is they will only really test for something that they have a drug or a medication they can give for. So in dealing with, for instance, thyroid, they have one tool to work with, that's levothyroid or thyroxine or Armour thyroid. That's really their only tool. So they're really going to look at one thing: what's going to affect TSH. They're not going to look at what's going to affect everything else. They don't have any tools for it. So to really just start getting into the underlying causes, you've got to get outside of the standard box to get the results. It's just, it kind of drives me crazy when I look at our healthcare system, because we spend the most money per person, but we get a very poor result. I mean, right now, last I read, we're about 30 to 35th in the world in longevity, and I think our overall health quality is down around 37 or 38. We're not getting a good result for the money that we're spending. You got to look outside of the box that we have, just kind of like with your car insurance. Your car insurance does not cover your oil changes and cleaning the car and rotating the tires and your maintenance work. Your car insurance covers you when you run into somebody. Our health insurance really was initially designed for the crisis mode, and then people took care of their daily wellness, and it just doesn't operate like that anymore. So you need to get outside of that box if you want to get a different result. So lab values. This is why if they say your lab values are normal and you're okay, why you still feel sick. And this is a different point of view. We look at functional lab ranges. So kind of imagine your YMCA summer camp. You got the archery target, bullseye, and you got the target, and then you got off the target. Your bullseye is ideal health. That's where you want to be at. Between the edge of the bullseye and the edge of the target is functional values. And then off that, we call medical or abnormal high values. So a couple of problems with that. One is what we've seen is over the years, the medical values have changed. Because what happens is every year or so, all the lab companies put together all their values, and then they figure out the middle, the average, and then standard deviation that create the normal ranges. Problem is, who are they testing? The sick people. So what we've seen is the values have gotten bigger and bigger and bigger and bigger. You can have somebody where 40 years ago they might have been diagnosed with a problem based on the lab work, but now they said, oh, they're fine because they're normal values. We look at functional values, where you should be, and then compare that, especially in different patterns, look at where some underlying dysfunctions might be. If you come in and your protein's off, and your calcium's off, and your chloride's off, and your BUN's off, and your albumin's off, I might go, boy, you have an absorption issue. You're not absorbing your foods properly. Or if your thyroid, if your cholesterol's up, and your inflammatory markers are up, I might go, you got a little bit of a problem. But if cholesterol is up and no inflammatory issues, I'm less concerned. So we look at things differently from a functional perspective. So some examples. Blood sugar. Traditional medical values, 65 to 110 is considered normal. Functional ranges, 85 to 100. So you walk in with your blood sugar 73 and they're going to say you're fine. But really, in reality, you're operating as you're hypoglycemic. Your blood sugar is low. You're going to be tired. You're going to be cranky. You're going to be sensitive to missing meals and all of that. So one of the major reasons we're getting chronic people better is we're doing the testing. We're looking for the underlying causes. We're looking for what's happening in the background so we can actually support a patient properly. And it's very different from a PPO or an HMO environment where, in a sense, what they're looking at is what's the minimum care they can deliver to get some sort of result to make a patient happy. If you're in an HMO environment and you deliver this kind of care, they kick you out. They don't want you in their network because it's costing more on the upfront and not looking at the long-term picture of, is this person healthier? Are they coming in less often to receive care? And also, here's the ultimate part of it. Medicare kind of sets the standard for insurance companies. And this is from the 2014 Medicare manual, and I don't think it's changed because this was pretty much the same as the 2012 Medicare manual. It says this. I'm just going to read it verbatim. A treatment plan that seeks to prevent disease, promote health, or prolong and enhance the quality of life. That's a pretty good idea, right? Or a therapy that is performed to maintain or prevent deterioration of a chronic condition. That's a good idea, right? Is not a covered benefit. I just want you to think about the insanity of that. What you actually need to do to be healthy, they're not going to cover. That's just weird. I don't know what else to say about that. So if you come in our office, based on your history, you might run any or all the following tests. You know, a complete blood chemistry, including thyroid markers, the HbA1c that tells us your blood sugar over the past 90 to 120 days. We'll look at lipids, a CBC, are there underlying anemias or infections? Salivary hormone testing, what is the cortisol levels doing throughout the day? Stool ecology profile, see if you have poor gut flora. We're learning more and more and more about the power and the relationship of good bacteria in the gut and immune function, weight gain, weight loss, whole host of things are all connected to the good bacteria in our gut. Almost every patient that I work with, we're always starting with digestion first. I think it's very sensitive to our environment. Our food is full of antibiotics and pesticides and different chemicals that affect the flora in our gut, and we abuse them. Cyrex lab testing. I don't use this one a lot, but I will. When I look at food sensitivity, a lot of times I just look, it's like, okay, we're going to assume you're like everybody else. We're just going to eliminate some things for a few weeks, and then we're going to do some and see how you respond. Some people need to see more. But one thing is valuable with this one is we can also look at the health of the gut wall. How healthy is the gut wall? That can tell me a couple of things. How long might it take to get the person better? And if the wall of that gut's not healthy, we also know it's going to be affecting a lot of other things. You know, like our immune system, 60 to 70% of it is gathered around the intestinal system. You know, we make 60% of our serotonin in our gut. We convert 20% of our thyroid hormone from the inactive form to the active form in our gut. So we have poor gut function. We affect a lot of things in the body. That's why we do so much work with digestion. Also, too, if your immune system is overreacting, attacking your different tissues in your body, once we have to go back, we got to deal with the gut and get the immune system supported. We'll look at genetics. I do it really simple. I use some of the online companies like 23andMe. You get to find out where you came from. I get a complete data set that I load into another website and get the profile of what are the genetic weaknesses that we might need to support with you. Organic acid, this looks into function of mitochondria, your energy production. pH testing, electrolytes in your red blood cells, chronic viruses, Lyme's disease, etc. You know, every patient's different. We look at what's going to help one person is not going to help the next person. The next person has very unique needs. We get a full picture so we can actually design a protocol individual to that person. How many of you had these tests performed? All of them. Or how many of you have even investigated them? Probably not too many. So a recap. Fibromyalgia and chronic pain. It's a neurologic problem due to underlying metabolic issues. And these problems are not often efficiently addressed by traditional health care. And through thorough and proper testing, we can identify and address the underlying causes, and at the end, sick neurons get healthier. So in a sense, when a person comes in, whatever the condition, today we're talking about fibromyalgia and chronic pain. You could have thyroid disorders. You could have You could have irritable bowel, colitis, whatever it is. We have all these different pieces of the puzzle: the cortisol, the blood sugar, the hormones, the brain activity. It's this jumbled set of puzzle pieces. And you might have tried some of your own approaches using the puzzle pieces you thought were important, but maybe they weren't your puzzle pieces. Or your picture looked different than the person you're talking to that gave you these ideas. We need to find out what your health picture looks like and what your puzzle pieces are to start to reorganize them. As we start to reorganize them and support you, we start to get on the right track. When we do that by treating you as a whole person, not just one isolated problematic system. So, at the very beginning, I said I would tell you what you can do next. So what's next is, if this conversation makes sense to you, if it doesn't, please don't call me. I'm not here to convince you to come to see me. But if this makes sense to you, pick up the phone and give us a call, or respond to an email. My email is at the end of this video. There's many ways you can get a hold of me here. But reach out. I offer a courtesy 15 to 20 minute consultation. I'll sit down with you. I'll talk with you, find out, I think you might be a candidate for care in our office? And at that time, if I know I can help you, I'll let you know. And if I think I can help you, we'll talk about what might be next. And what's next is come in for 2 other visits, separate from that initial consultation. And during those 2 visits, we'll do a complete neurological examination, review any existing labs that you have. Often what we do is, from when you have that first consultation, we'll actually order our first set of labs. I actually have them with me, so I can actually have an even better conversation with you. Fill out some detailed paperwork that gives me some good history information about you. And then also I request if you come in and do that, if you're somebody that makes your health choices by yourself, come by yourself. But, if you're in a relationship with somebody and you make choices together, I really want you to come in with that person. Reason being, on this video, we've talked about a lot of information. And then during the exam, we're talking about a lot of information. And then when it comes down to explaining my recommendations to you, which you do on a second visit, if somebody else comes along with you, or you go home and try to share that with them, they don't understand. They don't understand what you're talking about, and they don't get the impact of what we're working with. So on a second visit, I'll review your case, let you know really if I accept your case at that point. Talk about and start to get you started on the protocol, and I'll lay out the protocol that you would need and get you started on. I'll also talk about the finances to it. People often ask me about the insurance side to it. I think I touched on it briefly before. The insurance companies aren't designed to support this kind of care. So what I do in my office is I work with people. Now if you come to my office, I work for you, not for somebody else. I always tell people, if you can afford $200 to $400 a month, you can make care in our office here work. The first thing is find out, can we help you? And then you and I sit down, kind of take off my doctor hat, we put on my financial manager hat, and we see what we can do to get things workable for you. The 3 rules to be here in my office. You must be willing to make changes. I just the other day, I just refunded somebody their entire case fee because they were 3 months in and they weren't following what I was doing. They weren't doing what I was telling them to do. They were complaining a lot. They weren't following my recommendations. I looked at it as like, I couldn't, with any integrity, A, take their money, B, want them representing what I do, so it discharge them and close their case. You got to be committed to making a difference. And you got to need to take accountability for your health. You get one trip around this tour through life, and you need to take care of what you have. How you are, you can say, as a result of all the decisions you made in the past or things that happened to you, you need to create a new path, a new future with new actions. And once again, understanding that you got to be committed, you got to be willing to take accountability for your health. My job is here as your coach and your teacher and provide you with what you need to do, but you're only going to be in here a short period of time. You got your whole life to be out with. You need to take accountability for what you do. And just understand that we don't deal with insurance because it just doesn't work. So at the end of this, you might be watching this, think this actually makes sense to you. If you want to, I look for, you got to look at some basic things. On a scale of 1 to 10, how serious is your condition? How is it affecting you? How's it affecting your work, your ability to enjoy what you do, being with family, with friends, the hobbies that you like doing? How's it affecting you, or how could it affect you if you don't change what's going on? You also look on a scale of 1 to 10, how serious are you about getting better? How serious are you about dealing with your health? You know, due to time constraints, I only accept people that are really truly committed to getting better. And if that's you, you know, I'd love to work with you. I suggest you reach out to me. You know, and my information's here. It's probably on the email or the Facebook posts or YouTube pages that you got this on, but my information here is at my office, 763-634-5892. You can also reach me at drmays@askdrmays.com. And just reach out to us. We'd be happy to set up a consultation with you and see if we can help you. Otherwise, thank you for watching this, and be healthy and be happy.